my lower custom tray here. Very similar to what I did with the upper custom tray. I don't keep separate lower blanks for my base plate material. I just take an upper, I make a slit down the center there. And then again, I'm going to press it down onto the model. I want to make sure that it's pressed right in and adapted to the model. And you can see where I've drawn the line. Just going to use my knife and just cut. All the way around. Now, some people, if anybody's watching this on if I ever do put this on YouTube, you may be looking at my line and saying, that's way short of the sulcus. Yeah, it is short of the sulcus on this impression, because this is a preliminary impression, which is an overextended impression. What I've done is made the tray so that it is just past the area of the mucogingival junction, because that's the area where the denture is going to end. If you're making a custom tray which is going all the way to the edge of this impression out here, all of this is just the patient's cheek and their lip. That's not where we're going to be making a denture. We're going to be making a denture that seats on the patient's bone, because that's the stable area to give support to the denture. And just use my instrument to push the edge of my base plate material up to the line that I've drawn. I'm always telling my students that my favorite instrument is my pencil. Before I do much of anything, I sit down with my pencil and I draw a line to analyze what I want to do. If you're going to draw a line, follow the line. If you're not going to follow the line, don't bother to draw it. And following the line means that, like a margin in Crown and Bridge, you should see the line. So my material should come right to the line and then stop. Not short, not long. Now I can adjust that when I'm trimming, but you know what? It's really fast and easy to do it right now. Faster and easier than when I'm trimming. So I like to do it now. And again, I'm going to make a handle. I didn't talk too much about the handle on the upper. The handle on the upper should sit just a tiny bit onto the buccal side of the crest of the ridge, and have a slight angle coming out to the labial. Doesn't have to be a huge angle, 45 degrees, shouldn't be straight down 90 degrees. It should be somewhere between the two of them, around 60-75 degrees. It's approximately going to be about where the teeth would be. If there are any people from labs watching this, they may be saying, oh my lord, look at how small that handle is. You know what? It's big enough, and it's not going to interfere with the patient's lip. I've had lots of trays come from labs that had great big handles on the custom tray that looked like a huge hockey stick. And the problem is, when I'm trying to do the border molding on the impression, that big hockey stick of a handle gets in the way of me being able to manipulate the patient's lip. So, a handle that's in about the position where the teeth are going to go gives me more than enough room to be able to manipulate the tray and get it in and out of the patient's mouth without interfering in how I can manipulate the patient's lips while I'm doing the final impression. For my lower here, it's a little bit thick. For my lower, I want my handle to be directly over the ridge. Straight up 90 degrees over the ridge. I don't want it to interfere with how I'm going to manipulate the patient's lower lip as I'm doing this impression. Values for these handles, the values that I give in my textbooks are about 10 millimeters wide, 10 to 12 millimeters wide, 15 to 18 millimeters high. Yeah, I mean those are all variable as to the situation of the patient's mouth, but that's an approximate range, so about yay big. Okay, and then we can trim it down from there. I've got a little asymmetry. Actually, I got a lot of asymmetry on this side. I'm just going to trim that off later. I'm not going to try and play with it now. And this is ready to throw into my light cure.